Hello, I'm Luis. I'm here to present to you Guardian Angel, the next generation in home care monitoring. I'm going to share with you a personal story about my grandmother. She was funny, enjoyed life, and when it came to her safety, she played it very safe. One day, she asked for a camera to monitor her room in case of intruders, so I installed a camera that I could monitor from my phone. One night, she started feeling sick and had a horrible fever. My mother took her to the hospital, and she unfortunately wasn't able to recover and later passed away. While she was at the hospital, I looked over the footage that the camera captured, and I could see her standing up at 3 a.m. in the morning, hunched over her bed, looking very confused and needing help. When I think back, I really wished I knew more so I could have helped her, so I could have been there for her. This isn't just a concern of mine, but a concern of many families. Today, there is a lack of sufficient monitoring tools that impact a large number of seniors or other home care patients. Most have significant weaknesses that require manual interactions. The problem just doesn't impact the patient, but also their families. 11% of caregivers are less likely to engage in preventative healthcare behavior for themselves. Some 16% of caregivers feel emotionally strained, and 26% say taking care of their family members is hard on them emotionally. Lastly, the economic concerns. Home care is expensive for families and can see an average monthly cost of $3,000, and they can spend up to $41,000 annually, which will lead to many families taking on the responsibilities themselves, which impact their jobs and careers. Our solution, Guardian Angel, will help enable families. And here's how it works. Step 1. The patient will be monitored by wearing a wrist device that tracks, monitors, and sends data for processing to a central hub. Step 2. The hub then sends data to an offsite server for processing. This is where we'll take advantage of data analytics and measure patient vitals and establish their baselines. Step 3. That information is then shared to families who can set triggers and alerts whenever a threshold is met. We'll also enable families to read this data on a dashboard, which can be shared with family nurses and doctors. And for those who want to leverage their existing smart home device, they can to provide themselves a better, richer experience. The benefits we offer is the power of analytics to provide you real-time information on your family member. And with the addition of smart home devices, we can make that better. All of this could be done at a reasonable price. Overall, we provide a connected family that is not constantly worried about leaving their loved one alone. So, what does this market look like? In the United States, we have 49 million seniors, with that population expected to grow at 27% by the year 2050. Currently, there are roughly 5 million in some type of home care program in a market that's estimated at $250 billion. In terms of the competition, we were looking at other personal emergency response systems. They typically aren't very intuitive and offer very little in terms of features. In addition, they cost a lot upfront. Guardian Angel, on the other hand, provides a very technically savvy solution at a reasonable price. That price is $20 a month, where you will have access to a wrist device and a home hub. For those who stick with the subscription for 3 months, they'll have these devices for free. And for those who want a more premium service, they could pay up to $30 a month. Now, how do we plan to go to market? We first plan to build a web presence and leverage the power of social media. We plan to share our research on home care and reach out to the next generation of caregivers whose parents are nearing their 60s. We also plan to establish partnerships at industry conferences such as the National Association for Home Care and Hospice and the Home Care Association of America. And lastly, we will build relationships with assisted living facilities where we can show the value of our product by enabling their staff and providing further visibility for families. So who's going to bring this product out to the world? We have Brant Pierce. He's a current ASU student and full-time application developer. And myself. I am an ASU alumni with 5 years of experience in consulting and application development. Thank you all for your time and join us to help families be families with Guardian Angel. Thank you.